The symptoms you need to know about alcohol and drug withdrawal. When you have an addiction to drugs or alcohol, quitting can be difficult. In fact, for some people, it can be downright dangerous. This is because when you abruptly stop using drugs or alcohol, your body goes into withdrawal. Withdrawal symptoms can range from mild to life-threatening, so it is important that you know what to expect before you try to quit. In this video, we will discuss the most common symptoms of alcohol and drug withdrawal. Alcohol and drug withdrawal symptoms. Withdrawal symptoms vary depending on the drug or alcohol you are using. However, there are some common symptoms that are seen in most cases of withdrawal. These include anxiety, insomnia, nausea and vomiting, sweating, diarrhea, muscle aches and pains, headaches, irritability, fatigue. In some cases, withdrawal symptoms can be more severe. If you are withdrawing from alcohol or sedative medication, you may experience seizures. If you are withdrawing from an opiate drug, you may experience intense cravings and anxiety. In rare cases, people have even died from withdrawal symptoms. It is important to note that not everyone will experience all of these symptoms, and the severity of the symptoms will vary from person to person. However, if you are detoxing from drugs or alcohol, it is best to do so under medical supervision. This way, you can be monitored for any potential complications and get the help you need if things start to go wrong. How can you prepare for withdrawal before quitting? The best way to prepare for withdrawal is to detox in a safe, medically supervised setting. This will help to minimize the risk of complications and ensure that you receive the necessary support during this difficult time. If you cannot access a detox program, there are still things you can do to make withdrawal less painful. For example, you can gradually reduce your intake of drugs or alcohol over a period of time. This will help your body to adjust to the change and make withdrawal symptoms less severe. Another important thing to remember is to stay hydrated. Drinking plenty of fluids will help to flush toxins out of your system and prevent dehydration, which can worsen withdrawal symptoms. Finally, be sure to eat healthy foods. Junk food can make withdrawal symptoms worse, so it is important to stick to a balanced diet. Tips for coping with withdrawal symptoms. When you are quitting drugs or alcohol, it is important to have a plan for how you will cope with the symptoms of withdrawal. Here are a few tips for coping with withdrawal symptoms. Drink plenty of fluids. Dehydration can aggravate withdrawal symptoms, so make sure to drink plenty of water and other fluids. Eat healthy foods. Eating nutritious foods can help your body cope with the stress of withdrawal. Get plenty of rest. When you are going through unpleasant withdrawal symptoms, it is important to get as much rest as possible. Seek professional help. If you are struggling to cope with withdrawal symptoms, it may be helpful to seek professional assistance. What treatments are available for alcohol and drug withdrawal? There are a number of treatments available for alcohol and drug withdrawal. Some people may require hospitalization, while others can be treated on an outpatient basis. The most common treatments for alcohol and drug withdrawal include medications. There are a number of medications that can be used to help ease the symptoms of withdrawal. These medications include sedatives, antipsychotics, and antidepressants. Behavioral therapies. Behavioral therapies can help people learn how to cope with and manage their addiction. This type of therapy can also help prevent relapse. Detoxification. Detoxification is the process of ridding the body of drugs or alcohol. This can be done in a hospital setting or at home with medical supervision. Finding a rehab facility and making the decision to get clean. Making the decision to get clean can be difficult, but it is ultimately worth it. If you are ready to get sober, you need to find a rehab facility that can help you. There are many different types of rehab facilities, so it is important to find one that fits your needs. When choosing a rehab facility, you should consider the following: the cost of treatment, the location of the facility, the type of treatment offered, the length of treatment, the qualifications of the staff. Once you have chosen a rehab facility, it is important to make the commitment to get clean. This means abstaining from drugs and alcohol completely and attending all of your appointments. If you are willing to do the work, you can achieve sobriety. How can you prevent relapse after completing treatment? After you complete an addiction treatment program for drug or alcohol addiction, it is important to take steps to prevent relapse. Some things you can do to reduce your risk of relapse include attending support groups, staying away from people who use drugs or drink alcohol, avoiding places where drugs or alcohol are used, making healthy lifestyle choices, such as eating healthy foods and getting enough exercise. Seeking counseling or therapy to help you deal with triggers and cravings. Take the medication prescribed by your doctor to help reduce the risk of relapse. Quitting drugs or alcohol can be a difficult process, but it is important to do so in order for your health and well-being. Drug or alcohol withdrawal symptoms are only one part of the withdrawal process, but with professional help and support, you can overcome addiction.